ERPeak, Endometrial Receptivity Test. Section 1, Introduction to Endometrial Receptivity. Endometrial receptivity describes the ability of the endometrial lining to support embryo implantation. The time period during which the endometrium is most receptive to embryo implantation is known as the window of implantation. In a natural menstrual cycle, this window is generally 8 to 10 days after ovulation. For women undergoing IVF, the window of implantation is typically 5 days after she begins taking progesterone. This is commonly referred to as P+5, and typically an embryo transfer is done on this day. In approximately 30% of recurrent implantation failure patients, this window opens slightly earlier or later than P+5, for example on P+4 or P+6. This may explain why some patients experience implantation failure despite having good quality embryos. By knowing when the patient's endometrium is most receptive, you are able to schedule an embryo transfer to match your patient's receptivity status. Section 2. What is endometrial receptivity testing? Endometrial receptivity testing measures the expression of hormone-regulated genes involved in endometrial receptivity. CooperSurgicals ERPeak test uses a targeted approach, focusing only on genes which have been demonstrated in literature to play a role in endometrial receptivity. The ERPeak test involves 4 steps. Step 1 is to obtain an endometrial biopsy during a mock cycle. A mock cycle follows the same protocol used during an embryo transfer cycle, but rather than transferring an embryo, you will obtain an endometrial biopsy. 2. Following the endometrial biopsy, the sample is sent to a Cooper Genomics laboratory for analysis. 3. Cooper Genomics will report the ERPeak test results within 15 days after receiving the biopsy sample. 4. The final step is to discuss the test results with the patient and plan next steps. Cooper Genomics' team of expert genetic counselors will also be available to answer questions about the testing process and results. Section 3. Endometrial Receptivity Test Results. The ERPeak test identifies the 4 stages of endometrial receptivity: pre-receptive, post-receptive, receptive, or non-receptive. ERPeak also provides a recommended transfer time in cases where the results are pre-receptive or post-receptive. A receptive test result means the patient's window of implantation is within the expected time frame and her endometrium is in the receptive stage. In such cases, embryo transfer is recommended at the same time as when the endometrial biopsy was taken. A pre-receptive test result means the patient may have a displaced window of implantation and her endometrium is not receptive yet to the embryo. In such cases, embryo transfer is recommended later than the time at which the endometrial biopsy was taken. A post-receptive test result means the patient may have a displaced window of implantation and her endometrium is past its receptive stage. Therefore, embryo transfer is recommended earlier than the time the endometrial biopsy was taken. A non-receptive test result means the patient may have a displaced window of implantation and her endometrium is in the non-receptive stage. In such cases, you should discuss treatment options and next steps with your patient. This may include taking a second endometrial biopsy and retest to confirm the test results. On rare occasions, the ERPeak test may not be able to produce a result. A repeat biopsy may be recommended in these instances. While endometrial testing may increase the chances of successful embryo implantation, a mock cycle is required for the endometrial biopsy, which will delay the embryo transfer cycle. Although around 70% of cycles dictate no change, approximately 30% of cycles do indicate a change in transfer protocol. Knowledge regarding the optimal window of implantation will inform the embryo transfer timing for the next cycle. An embryo may fail to implant for many reasons, and endometrial receptivity testing does not guarantee successful implantation or pregnancy. Successful implantation is maximized when a patient has good quality embryos and a receptive endometrium. The ERPeak endometrial receptivity test could help you make an informed decision about when to transfer your patient's embryo. Ask your sales representative or your clinic care team on how to get started with ERPeak endometrial receptivity testing, or visit us online at coopergenomics.com for more information.